Providing more access to health care is a top priority for AARP Oklahoma. That's why we're endorsing Senate Bill 1616, which helps restore and provide more funding for Insure Oklahoma. Insure Oklahoma is a premium assistance program that helps employees, employers provide insurance, health insurance to their
What we're talking about is Senate Bill 1616, but that is also known as the pay-your fee. What that will do is it will assess private insurance companies such as Community Care, Blue Cross Blue Shield, Pacific Care, Aetna, on the claims that are made, and that money will go to the state insurance fund, with the proceeds going to pay for Insure Oklahoma. Right now we have 700,000 Oklahomans that have no insurance. Those of us who do have insurance, be it private insurance, be it the Medicare program, be it the Medicaid program, we all expect that everyone will carry their fair share, carry their weight in paying their health care costs. Those 700,000 don't have the resources to pay for the doctor, to pay for the hospital when they get sick, but they still get sick. You and I, those of us who have the insurance, pay for that in the cost shifting. When you wonder why it is that the bill has a $15 aspirin on it, why is it that there's a $10 tongue depressor? The reason why is that that hospital is trying to recover its cost from you, the person who has insurance, to pay for the cost of the person who didn't have insurance. It was in 2004, the state legislature presented a question to the people whether or not they wanted Insure Oklahoma and whether or not they wanted to put a tax on themselves on tobacco to pay for it. Both questions were answered in the affirmative, and since then we've had a tobacco tax which paid for the Insure Oklahoma program. Because of the amount of money that the tobacco tax brings in, we are able to cover 40,000 Oklahomans that were not previously covered. This has been a successful program once everyone understood what was happening, and we're nearing capacity. Currently we're in the mid-30,000s on the number of Oklahomans which have that insurance. If we continue at this rate without adding additional dollars, we're either going to have to cut back on the insurance that's being provided, which defeats our purpose, or we have to put people on waiting lists. What we're looking at is that third alternative, which is to provide more money. Rather than providing a general tax on the people of Oklahoma, what we're proposing is an assessment against the private insurance companies, all of whom support this, in order to generate enough money to match the federal government's share and provide insurance coverage for all of Oklahomans. The way it works is it's part of our Medicaid program, where the state and federal government put up a combined 60% of the private insurance premium. The employer would put up an additional 25%, and the employee would be required to put in an additional 15% to get you to the private insurance premium. But when you go to the insurance company, when you go to your doctor, you will provide an insurance card that shows that you've got Blue Cross Blue Shield. It will show that you've got Community Care, whichever product it is that you purchased. It's been designed specifically for Insure Oklahoma. There is no difference between the insurance card that someone would have through private pay and the insurance card that an Insure Oklahoma member would have. It's a tremendous impact on the small businesses in Oklahoma. The cost of health insurance is so great for the small businesses that they will either not offer health insurance because they can't afford to do that and pay their employees, or they will offer it at such high rates that it becomes unaffordable and a job killer, not only for the employees but for the employer. What this will do is it will provide an alternative where rather than paying 50%, 75%, 100% that an employer would normally be expected, he pays 25%. For the employee, he pays 15%. The state of Oklahoma, along with the federal government, may pay 60%, but it is actually cheaper for us than to have to pay for the expenses of the hospitals, which are having to write off the bad debt, for the hospitals that are in danger of closing, for the physicians that say that they can no longer keep their practice open because we've got so many people that aren't being covered. 1 in 5 Oklahomans does not have health insurance. Think about the room of 10 people, 2 of them don't have health insurance. That's too high. We've got to take. If we don't find an additional funding mechanism for Oklahoma, which is the pay-or fee that's being proposed, we will meet capacity of 40,000 sometime next year, and we will either have to start cutting back on the programs and the coverage that we provide, which those individuals will still need, we just won't pay for it. or we'll have to put people on waiting list until there's an opportunity for them to get on. Neither one of those meets the core purposes of the Insure Oklahoma plan, which is to make sure that these people that have no insurance have opportunities to help pay for their fair share of the health insurance costs. I think that there are a lot of people that are interested in this. I think that the bill will continue to go to the House, but nothing is a sure thing until it's passed and gone to the governor. The legislature will spend the next 2 months actually paying close attention to this bill.
AARP has long been supportive of Insure Oklahoma and its expansion. We appreciate Senator Crane's leadership on this issue as we try to get more uninsured Oklahomans and provide them with quality health care.